Today we have an AMC Recall question from April 2024. It is a Resp Gen Med question. So let's get into it. What are the initial investigations for the likely diagnosis? So these are our answer options here. Okay, remembering to read these answer options first. I find it most helpful. You may not. So we need to know the diagnosis before we move on to the investigations. 59-year-old woman with 3 months of cough, blood-tinged sputum, so hemoptysis, night sweats, and 5 kilo weight loss. Past medical history of type 2 diabetes, hypertension. She has never smoked. Okay, what I'm thinking is 3 months. She has hemoptysis. She also has constitutional symptoms or B symptoms. So this is either trying to tell us that this is malignancy or primary lung cancer. Okay, could be something else though, because it includes that she's never smoked, and it's only been happening for 3 months. So another thing I am thinking is that it could be tuberculosis. Okay, and the fact that she has never smoked, the fact that it's only happened for 3 months, and type 2 diabetes is a risk factor for tuberculosis, because remember, a lot of type 2 diabetic patients are immunocompromised. It's kind of leaning me towards tuberculosis. And the fact that I'm seeing sputum culture, different sputum samples, acid-fast bacilli, and interferon gamma release assay in the answers kind of tells me it's tuberculosis as well. Okay. So what is the best initial investigation? So you pretty much have to know how to diagnose TB. Essentially what you have to do. So this is a little diagram I've taken from the Royal Australian College of General Practitioners. Okay, and let's walk through it with this question. So this lady has symptoms, obviously, yes. Clearly then it's an active form of TB. And the next best step is chest x-ray and 3 sputum samples. So there you go. That's the best answer. So it'll be chest x-ray, 3 acid-fast bacilli sputum samples. So let's go through, what if she didn't have any symptoms? It'll be a latent form of TB. You can do a tuberculin skin test or an interferon gamma release assay. Now, if it says if TST or IgRA positive, exclude active TB and follow up. Okay. So if it was negative, you would then go to the chest x-ray and sputum samples. So you can kind of exclude all the other answer options from that. I'll just quickly go through a little bit about the interferon gamma release assay. Okay, in Australia there's 2 types. There's the quantiferon golden tube and there's the T-spot test. Okay, both of these are unaffected by previous BCG vaccination. Okay, so they are kind of preferred to the tuberculin skin test, because remember that can show a false positive if you have had a previous BCG vaccine. And what it tells us is that you have had TB in the past. It cannot diagnose active TB though. Okay, and in Australia you're not going to see TB a whole lot. Okay, but in populations you will see it, and in questions I've seen on the AMC, it will be in Aboriginal and Torres Strait Islander populations and potential immigrants coming over, okay, and Papua New Guinean population. Okay, remembering that TB can affect all different systems of the body. You can get disseminated TB or miliary TB, however they like to say it. Okay, so you can get things like psoas abscesses, a pretty high yield. Pot disease is also high yield when TB affects the spine. Okay, and remembering the medications to treat TB. So the RIPE mnemonic, RIPE. Okay, you have rifampin, isoniazid, pyrazanamide, and ethambutol. It's important also to note that this lady has had a 3-month history. Okay. And a commonly seen question that has shown up throughout just some USMLE style questions and AMC questions is, how long after TB exposure will someone's sputum cultures be positive? Okay, so it kind of needs 2 to 5 weeks. So most likely it'll show up, probably 2, 3, 4 month history of hemoptysis and these constitutional symptoms. Okay, it won't be a week after, because most likely the sputum samples aren't going to be positive. And that's pretty much it. That's all you need to know for TB, really. Not that common in Australia, okay, but obviously I have seen about 3 or 4 questions now from some recalls in the past kind of 5 years on TB, so it is important to know. If you're liking the content, please like and subscribe. Comment if you want me to do any extra questions that you've seen. And also let me know if I'm doing a good job. Let me know if there's anything else you'd like to see. Thank you.